Hello everyone, I'm happy to be here and thank you for this opportunity. I'm Dr. Emmanuel Kiiza Mwesiga. I'm a psychiatrist, senior lecturer and head of psychosis research in the Department of Psychiatry at Makerere University. Over the next few minutes, we're going to convince you that we deserve to win £200,000 as part of the winners of the Mental Health Data Prize. We all know that data is the new gold, and in health research, this gold can be found exclusively and in large numbers in patient health records. Every day, patient interactions between clinicians and patients are recorded, and it is in these recordings that a treasure trove of information is hidden. It is this information that can transform research, and especially mental health research. In Africa, unfortunately, a lot of this recorded data is in handwritten patient clinical files. And although electronic medical records are on the rise, their use is still limited, and historical data is not being integrated into these systems. We therefore ask 4 critical questions. 1, can we transform patient clinical data into a usable data set for research? 2, can this process be done ethically? 3, is this process scalable? And 4, but most importantly, can we involve clinicians and lived experts who are the most important beneficiaries of this research? The answer to these 4 questions, we believe, is a yes. We hypothesize that artificial intelligence applications, in combination with lived experts, can transform patient clinical records into data sets for research. We have developed a prototype called Hekima, which in Swahili translates to wisdom. Hekima is an AI algorithm that transforms patient clinical data into a data set for research. For our project, we will demonstrate Hekima's ability to extract data from patient clinical files into an actionable data set for research. Specifically, we will examine for the predictors of sustained engagement in patients with psychotic disorders. We previously tried to do this by reviewing patient clinical records, but could only review 100 of 1,667 files of patients presenting to Butabika for the first time in 2018.
I am Wilber Ssembajjwe, a biostatistician at Medical Research Council, Uganda Virus Research Institute, and London School of Hygiene and Tropical Medicine. I am the co-lead on this project. Let me show you how we are planning to overcome the challenge of converting handwritten patient data into actionable insights for research. When a patient comes to Butabika Hospital for the first time, a file is opened where their details are recorded on the face sheet. This file is then taken to a clinician who interacts with the patient, writes notes, creates a treatment plan, and schedules a date for review. Nurses, social workers, and clinical psychologists may also write notes in the file to record treatments given and other ongoing concerns or plans. After the patient leaves, the file is stored in a secure records room until the patient returns, at which point the file is retrieved and given to the clinician to write notes again. This process repeats itself whenever a patient comes. Therefore, every patient at Butabika Hospital has a file with data, almost 300,000 files at the last count. Previously, we manually extracted data from 100 of these patient files. This painstaking process was critical in building our initial data set and provided valuable insights into the predictors of engagement. However, it had limitations, including the small sample size or the limited predictors we could extract. A more efficient solution was required. We have built a prototype application with AI-enhanced algorithms that use the application programming interfaces, APIs, of existing large language models that allow us to transform handwritten clinical notes from patient files, save the extracted notes in text format, and store them in a database for analysis. The application interface has a graphical user interface that everyday users can use to access the data from the scanned files. First, we will retrieve not only 100 files, but 1,667 files of patients who previously came to Butabika Hospital for the first time in 2018. These files contain different patient and clinician interactions that we believe are a treasure trove of information. Each page of these files will be scanned using high-resolution scanners to create high-quality images and PDF files that will be saved in a digital archive on our on-premise server. Our developed prototype algorithm will then read through the scanned files on the server to interpret the handwriting from the different files, extract the information in the files, and then save the extracted data into a structured database that has been developed. Our algorithm will be trained to enhance its accuracy through the input of clinician-written samples and manual review of selected images through an iterative process to ensure the extracted data's integrity and reliability. With these measures, we aim to achieve an accuracy rate of over 90%, turning raw patient data into a resource for in-depth analysis. These AI tools can synthesize the data into highlight trends. With our database, we will use large language models and machine learning techniques to identify factors associated with sustained engagement. The identified factors will then be used to train machine learning models that will be used in predicting adherence to the next patient appointments. Collaboration with lived experts is key in this phase, as their real-world experiences help refine algorithm parameters, ensuring relevance and practical applicability. The final output is a comprehensive dashboard, providing predictors of sustained engagement that are actionable insights and scalable solutions to improve mental health care in Uganda and beyond. The entire process of file selection, digitizing, and archiving will be supervised by lived experts, peer support workers, and bioethicists as gatekeepers to protect patient rights, including confidentiality, non-maleficence, justice, and beneficence. Data security remains paramount. We will use advanced encryption and strictly follow local and international privacy laws like GDPR and Uganda's Data Protection Act. Access will be limited to authorized personnel with bioethicist oversight to ensure compliance and maintain trust. Privacy, compliance, and consent are integral to maintaining the highest ethical standards throughout the project. We will train young scientists to utilize the database resources with lived experts to generate independent research questions and investigate them using the database. We will meet with policymakers, academics, politicians, clinicians, and lived experts to explore how to make utilizing patient records for research scalable. These insights might be used to examine many questions, not just sustained engagement. Such a detailed method requires a strong collaborative team. Let us meet them.
I am Dr. Byamah Brian Mutamba, Deputy Executive Director and Senior Consultant at Butabika Hospital. We believe this project has a lot of potential to provide scale to the digital transformation that is already taking place in this hospital through an electronic medical records system. We have hundreds of thousands of records, and we believe that this project will enhance our capability to transform into electronic data management systems towards our mandate of being a center of excellence for service provision, research, and training in this country.
I am Phillip Oyat, and I am leading a digitization and archiving project at MRC Uganda in Entebbe. What we envision for this project is that we will be able to set up, scan, and archive the files within a period of 2 months. And in addition to that, we shall work with clinicians, lived experts, and bioethicists to build, train, and implement machine learning and deep learning algorithms that will extract text from the scanned file. This is Hekima, the prototype that will be improved by lived experts and clinicians. It's written in the Python programming language and will be able to connect to the APIs for large language models. We also have a front end that will enable users to interact with the system and upload files for data extraction.
Nanyonga is my name. I'm working at Butabika National Referral Hospital in the Medical Records Department as the Medical Records Assistant. Previously, I was involved in the research psychosis project and were able to extract 100 files out of the 1,667 files.
Amanya gange nze Nakasumba Francis. Mbadde nawummula nali nkolera wano mu Butabika mu ddwaliro ne ntuuka ku kuwummuzibwa olw'obukadde olw'emyaka, naye kati nkola nga peer support worker nga mbudaabuda abalwadde ab'omutwe, ab'obwongo, nga mbawa essuubi nti obulwadde bw'omutwe busobola okujjanjabibwa, omuntu n'asobola okubeera obulungi. Ndi mulwadde wa mutwe kati emyaka 46 nga ndi mu bulwadde. Obulwadde bwange babuyita bipolar affective disorder. Mu musomo guno ngenda kukakasa nti data yenna akuŋŋaanyizibwa mu fayiro z'abalwadde akuumibwa butiribiri era akwatibwa n'obwegendereza obutatyoboola ddembe lya muntu w'abalwadde.
My role on this project, I am going to work as the research bioethicist. We need to make sure that all the ethical principles in research are being followed.
Being involved with patients daily, I realize the need to understand their reasons for engaging with us better. I will help the process by refining algorithms for database generation, and I'll also provide insights into why patients engage with mental health services.
With this research, if nurses are part of it, it will give more insight into what the patients go through, because we spend most of the time with patients other than the other team members.
Once our data is digitized, we'll focus on developing machine learning algorithms to uncover the patterns within our data, and therefore use this information to identify the factors that predict sustained patient engagement.
My role on this particular project is capacity building lead, and the reason as why we build capacity is to ensure that once the research is completed, the people who remain behind have the knowledge, skills, and ability to execute different components of the study or execute and implement the outcomes that we would have identified. Why would we build capacity at all the different sites that we'll be involved in, which is Butabika, Makerere University, the MRC, and other partners, is because we want the next generation of either scientists or service providers to be able to execute these activities post the grant. Where do we get this experience from? We get this experience from previous work that we did in 2016, 2017, when we, together with 5 different universities in Africa and the Harvard School of Public Health, we built capacity for one of the biggest genetics research in the entire Africa, for research scientists to be able to execute and implement genetic studies and statistical analysis of complex data in Uganda and Africa as a whole. So we'll use the exact same patterns and modules to ensure that the people we work with have the capacity to execute all the assignments when the grant has come to an end.
We also on a move to digitalize medical records, and we shall obtain learning from this project how to effectively digitalize the existing records as we are shifting from paper-based records to electronic medical records.
Now that you've had our project idea and met our team, let's finish by summarizing as follows. First, we request for £200,000 to transform patient clinical files to data for research using AI applications. Second, our project should be viewed by the potential of these records for future research. Third, we're expanding on our previous work by examining more files using AI applications and collaborating with clinicians and lived experts. Fourth, we have already developed a prototype called Hekima. And lastly, this makes our project feasible, ethical, scalable, and collaborative.
However, this project must be viewed beyond Hekima and its ability to extract patient data. It should be viewed in the lens of AI working together with lived experts, clinicians, to drive the mental health research agenda for Africa.